Hi, my name is Erica Dry, and this is my presentation for the Remote Collaboration and Evidence-Based Practice video for Nursing4030. This presentation will reflect on a case study regarding a remote interdisciplinary collaboration focused on building an evidence-based comprehensive treatment plan for a patient living with anxiety. I will propose a plan based on recent research I found for the treatment of anxiety, including newer methods that still require more thorough examination. I will discuss the model of evidence-based practice I used to frame my treatment plan, and will also evaluate what resources I found to be the most helpful while conducting my research. We will also evaluate the benefits and potential pitfalls of conducting such a treatment plan remotely. Lastly, I will reference several peer-reviewed articles throughout this presentation, as well as a healthcare system that is well known and respected for their research. These references will be included in an attached document in an APA format. To start, for this presentation, we will be looking at the case study presented in which a 35-year-old female who has been diagnosed with anxiety lives in a rural area with limited access to mental health care. As such, she has been a patient receiving remote care from an interdisciplinary team that includes nursing, a licensed therapist, a psychiatrist, and a social worker. The patient presents with symptoms including restlessness, excessive worry, and difficulty concentrating. In this case study, it is presented that the patient has been in cognitive behavioral therapy, also referred to as CBT. The patient's therapist mentions using exposure therapy, relaxation techniques, and cognitive reconstruction, and has noticed improvements with the patient's ability to manage her anxiety levels and coping skills. CBT has increased in popularity as research has shown positive patient outcomes with many different mental health diagnoses, according to Cooper's et al.'s meta-analysis published in Psychological Medicine in 2022. The article discusses the increasingly high prevalence of anxiety disorders worldwide, and it explores the noticeable decrease of quality of life for these patients. It also looks at anxiety's influence on the population's economical costs. In addition to CBT, the meta-analysis also reviews exposure therapy as a specific treatment option for patients suffering with anxiety. Behavioral activation is a common therapeutic intervention for patients diagnosed with depression. However, this article stresses the possibility that focusing less on disorder-specific interventions and utilizing comorbidity-conscious therapies will build on maintenance processes for patients undergoing anxiety treatment. It is important to note that there is a growing consensus to identify a more unique approach in how we are able to classify, treat, and prevent anxiety disorders. This transdiagnostic approach, where we incorporate therapies more common for a different mental health diagnosis, will allow healthcare providers to identify patients' core maladaptive behaviors on psychological, emotional, behavioral, and cognitive processes. The article mentioned here offered great insight into various therapeutic interventions for patients suffering from anxiety. In Mangalini et al.'s article published in 2019, recent evidence-based practices were reviewed at a systematic level. This analysis offered a thorough review of a comprehensive treatment plan for patients diagnosed with anxiety, and was the resource I found most helpful while conducting my research. Discussed in the overview was the evidence favoring CBT and its effectiveness for managing and reducing symptoms. Alternative treatments have also been reviewed. However, more research is needed to evaluate effectiveness and any possible side effects. Such treatments could include yoga, massage therapy, aromatherapy, mindfulness, and physical exercise. The systematic overview discussed the lack of treatment for patients dealing with anxiety, even in well-developed countries. And while research has shown that therapist-directed CBT has provided the better results for patients, evidence is showing favor that computer-delivered treatment is helpful as well. Especially when we look at this case study, the remote and virtual care the patient has received has benefited her greatly considering the lack of resources around her. Evidence has suggested that not only can remote treatment plans be helpful for those without physical options, such as our patient, but they can also be a good option for patients who are not ready to begin formal psychotherapy. Selective serotonin reuptake inhibitors, otherwise referred to as SSRIs, are the first-line pharmacological therapy for patients with anxiety, according to Gossman et al.'s 2023 meta-analysis. Mangoli's systemic overview discusses the dosages in which patients reported symptomatic improvement. However, the article also highly recommends the concurrent use of cognitive therapy and pharmacological therapy. In the case study, the patient's psychiatrist recommended SSRIs, which we would assume would be for daily use, and benzodiazepines for acute symptom management, both of which are common therapies for anxiety. When we look back at Gossman et al.'s meta-analysis, concerns should be noted regarding side effects for SSRIs, as research shows that this is the most common reason for patients being non-compliant with their home medications. This resource provided to be the most useful with concerns to pharmacological therapies. Our patient's social worker offers resource management and can help the patient discover community resources as well. Using the proposed recommendations from the interdisciplinary group, the patient's care plan would include medication management, continuing her CBT sessions, and utilizing social work's help by encouraging the patient to engage in alternative therapies, such as yoga or massage therapy. Collaboration between the therapist and the social worker may also give the patient access to group therapy if she would be interested. Additional consults that may benefit our patient would be involving a psychologist for psychoanalysis or psychotherapy, both of which have shown beneficial to patients with anxiety. By following Johns Hopkins' evidence-based practice model, we are able to work cohesively for this interdisciplinary collaboration and may possibly be able to involve academically minded input as well as clinically focused research. By taking our initial inquiry, in this case the comprehensive treatment plan, and discovering recent evidence suggesting alternative therapies, such as remote sessions or computer-based resources, the healthcare team is able to learn and reflect on what methods were effective and reinvent the plan should it fall short. This approach will allow us to develop best practices for our patient and in turn implement practice improvements for this patient population. With a comprehensive treatment plan in place for our patient, she should be able to manage her symptoms more effectively and have a better quality of life. With the initiation of pharmacological therapy, continuing her remote CBT sessions, and with the help of social work to find alternative therapies available to her, our patient should see an improvement in her symptom severity and continue to improve upon her coping skills. Thank you for joining me in this case study reflection.